Hi, I'm Dr. Yusuf. Presenting to you this laser cataract surgery with Symfony lens implant. I'm inserting the LOI. This is now it's at 5 times speed just to save you time. I'm inserting the lens, putting BSS on to fill the chamber, going up, making sure there's no air bubbles. The laser is scanning the OCT of the laser, front, back of the cornea and the lens. Now it's going through the laser steps, and it's done. Release the capture and vacuum, move the bed out and up to the level for the cataract surgery. My scrub nurse already prepared the table for the surgery. I'm putting the drapes on. So opening the drape and putting the speculum, hold the eye open. Starting by the incision, freezing, viscoelastic, front and back of the cornea. The second incision, the cataract is already done, so I'll do hydrosection, hydrodelineation, and then removing the nucleus using the chopper, just pulling sideways, not centrally like we do normally. All the fragments are removed, epinucleus, then G cannula cortical cleanup. All this material is just moved out through the incision, and then the Helon and the Symfony. I'm folding the Symfony lens, which is the extended range of focus lens, so to give you distance, intermediate, close-up. And the lens is inserted. Irrigation aspiration to remove all the Helon, and just irrigation to remove everything from the corner of the eyes, from the chamber. Then hydrating the wounds using moxifloxacin, washing the surface, doing the dropless injection, and we're all done for the Femto with Symfony lens.